Listen to this growing epidemic in America. Nearsightedness is on the rise. A new study from the National Eye Institute finds more and more of us are dealing with this eyesight issue, and experts say our lifestyles could be to blame. Joining us now is Dr. Sreedhar Potarazu, also known as Dr. P, President and CEO of Vital Spring Technologies. First of all, Dr. P, what is nearsightedness?
Nearsightedness is a condition where the eye is longer, and as a result of that, light rays focus in front of the retina, which is sort of the film, and so the images are blurred. It can be something that's actually hereditary, and that's what nearsightedness is.
And it means that you see objects that are close up but not far away.
That's exactly right.
Okay,
exactly.
So researchers compared nearsighted statistics from 1971 to 30 years later, 2001 through 2004. What were their findings?
What they found is that the prevalence of nearsightedness was much greater, several-fold more, when they did the study 30 years later between 1999 and 2004, with a very high prevalence amongst African Americans. And there were some suggestions of whether education and people using their eyes more, which has been an age-old controversy in eye research, actually was a potential cause for the increased prevalence in nearsightedness, and what that actually means for our future costs to the system.
And what did they conclude? Why is nearsightedness up something like 42% now?
They haven't been able to come back with any real conclusions in terms of the why. And here's the problem, that if we look at a single point in time as opposed to cause and effect, we don't really understand. There were several studies which go back decades where they looked at monkeys in terms of trying to put in drops to prevent them from using their eyes, and if the incidence of nearsightedness was more. Now, I have two daughters who happen to be nearsighted, and as you well know, they're on the internet, they're on Facebook, they're on Twitter. Obviously, they go to school. The only way I could pick out cause and effect is if I kept one of my daughters at home and kept her away from the internet and no school, and the other one doing everything, and then measured over several years whether their eyes actually changed and whether the nearsightedness got worse. And we're going to have to look at that over a period of time to determine whether it's genetic, whether there are environmental factors that are causing that. If the prevalence, which in fact is so high, the cost of what it's going to be to the system is almost $2 billion if 25% of the population is going to be affected. And that's going to be a major point for us to consider in terms of what the impact in healthcare reform is going to be. That's a huge number.
Well, Dr. P, you make a great point. There are supposedly 47 million people out there who are nearsighted. Let's hope that we get some answers to all of this soon. Thanks so much for coming on.